Hi, thank you for being here. I want to start by telling you what keeps coming up. In the one-on-one lessons I've been giving to colleagues across many disciplines, one theme returns again and again, more than any other. Patients are using AI and they are walking into the consultation room with its answers ready to ask questions. Now, I want to be clear about where I stand because it shapes everything I'm about to say. I am one of the strongest advocates you'll meet for patients being active in their own health journey. For patients reading, asking, participating in their own medical journey. That is a good thing. I will defend it any day. But here's what the lessons keep revealing. Most clinicians are not equipped to have an informed conversation about AI with their patients. We do not quite know how to tell a patient when AI is useful, when it is not, and how to use it cautiously. And so, faced with a patient quoting a chatbot, we either get defensive or we retreat. So this module is not really about the technology, it's about the relationship and how to keep the patient's trust when a third voice has entered the room. So let me give you two scenarios. You will recognize both. First, you have a 17-year-old who is in front of you. You have examined them carefully and you have just reassured them that this is most likely a viral pneumonia. There are no worrying signs and you are happy to send them home with supportive care and clear advice. And they look at you and say, but ChatGPT told me I need an X-ray and that I should have biomarkers done to rule out cancer. Second, a patient comes in for a routine annual check. You go through everything and reassure them all their results are fine, but the lab had sent the results ahead and the patient had already fed them into a large language model. The potassium came back at 5.1. The module flagged it as hyperkalemia, warned of a dangerous heart rhythm and possibly death. And now the patient is not reassured. The patient is angry. They're telling you that you are negligent, that you are dangerous, and that you should have admitted them and managed a life-threatening condition. These are real conversations. They are happening to colleagues right now, and the reason they are so hard is not the medicine. The medicine here is straightforward. It is that the technology is new and the education around it has been complex, technical, and frankly sensationalized. We have all seen the headlines, AI will take our jobs, are you ready? But almost nobody has given clinicians practical guidance on how to actually talk to a patient about it. So let us go back to those two patients and let me reframe what we are actually trying to do, because if you get the goal wrong, every technique fails. The goal is not to prove the AI wrong. The goal is not to win the argument or to defend your authority. The goal is to give the patient informed guidance to help them understand where AI can genuinely be useful and where the judgment of a clinician is needed. If you do that well, something important happens. The patient does not leave feeling dismissed and quietly distrustful. They leave feeling that you took them seriously and that you helped them think more clearly. That is a stronger relationship than you had before they walked in with the chatbot. The challenge handled well becomes an opportunity. So I am going to give you a simple framework. 5 steps for conversation. Hold them loosely. This is a way of thinking, not a script to recite. So step 1, start by acknowledging the patient's effort. Before anything else, acknowledge what they did. A patient who is taking an active role in understanding their own health and conditions is doing something good. We should never discourage that. And notice what acknowledging it does practically. It calms the conversation down. It encourages the patient to keep reading, keep learning, keep being an active participant rather than a passive one. It tells them you are not threatened by their curiosity. There is also a humanity in this worth naming. Sometimes there genuinely is someone or something that explains a concept to a patient more clearly than we manage to. That is fine. That is not a threat to you. And here's the move that makes the whole conversation work. At this point, ask to see it. Ask the patient to show you what the AI actually said. And just as importantly, what they typed in to get that answer. This does 2 things at once and both build trust. First, you are not dismissing their concern. You are taking it seriously enough to look at it with them. Second, and this is the clinical gold, you will almost always see that a great deal of the context was never given to the model. The patient did not tell it the things you know. That missing context is usually the whole explanation for the alarming answer. Step 2. Should they keep using AI for their health? The patient will often ask or imply the question, so should I stop using this? And your answer should be honest and balanced. Yes, they can keep using it, but with a clear understanding of how limited it is on their side without a clinician's oversight. Here's how I explain it to the patients and it lands well. Remind them gently of what a doctor actually does. We go to school for many years, not just for the knowledge, but for the clinical skill of reaching a diagnosis. We take a proper history, which means we know which questions to ask. We examine, we have other data points, the vital signs, and now the lab results. And we weave all of that together with years of experience to narrow things down. A patient sitting with a chatbot has almost none of that. They do not have the full picture. They do not know which questions matter, and they do not have the experience to judge what the answer is worth. Even the more specialized health-focused versions of these models, and yes, they do exist, still carry a disclaimer that they can be wrong. So the message is not stop. The message is use it to learn and to ask better questions, but bring the answers to me where we can put it into context. Step 3. Can the AI be wrong? Yes, absolutely. And it helps the patient enormously to hear you say that plainly. Go back to the potassium of 5.1. The model saw that number and reached for the most dangerous thing it could mean. Hyperkalemia, arrhythmia, death, but it did not consider what you would consider in a heartbeat, that the sample might have been slightly hemolyzed, nudging the reading up. That in an otherwise healthy person, a level like that is very unlikely to cause a dangerous rhythm at all. The model did not weigh any of that because it did not have the context and it does not reason like a clinician. And there is a second possibility we have covered in an earlier module. The model can simply make things up. We call that hallucination. So you give the patient both halves of the disclaimer. The AI lacks context, and on top of that, it can invent. Both are real, and the patient deserves to know both. Step 4. Can we be wrong? And now the step that takes the most courage and earns the most trust. Yes, we can be wrong too. We are humans carrying enormous cognitive load, patient volumes, endless data points, fatigue. Is it possible for any of us to miss something? Of course it is. It would be arrogant to pretend otherwise, and patients can feel that arrogance from across the room. This is exactly why step 1 matters so much. When you actually look at what the patient brought to you, you are not only checking the AI, you are giving yourself a chance to catch your own miss. Occasionally, the patient or even the chatbot will have raised something genuinely worth a second look. Humility here is not weakness. It is good medicine, and the patient trusts you more for it, not less. Step 5, the confidentiality of their information, and finally the one almost no one thinks to raise, and the one that may matter most in the long run. The patient needs to understand that their health data is confidential and that pasting it into these chatbots puts confidentiality at risk. Be honest with them. When they feed their results, their symptoms, their identity into one of these tools, they do not actually know where that information goes, who can see it, or what it might be used for in the future in ways that could one day harm them. I give patients a simple test they never forget. I ask them this. That single question does more than any lecture on data privacy. It moves abstract risk into something they can feel. And it is something they can carry to every chatbot for the rest of their lives. Let me draw this together. Patients are using AI and they are bringing it into your room. That is not going to stop, and as the advocate for active patients that I am, I would not want it to. The question is only whether they have an informed guide when they do, or whether they are left alone with the chatbot. And you now have a way through. Acknowledge their effort and ask to see both what the AI said and what they asked it. Be honest that yes, they can keep using it, but its power is limited without your oversight. Be honest that the AI can be wrong for lack of context and through outright invention. Be brave enough to admit that we can be wrong too, and help them protect the confidentiality of their own information. Notice what this framework really does. It turns the most threatening moment in modern practice, the patient who arrives doubting you, into the moment you earn the most trust. Because the clinician who gets defensive loses the patient quietly, but the clinician who leans in, looks at the screen with them and helps them think, that clinician becomes something the chatbot can never be, a trusted human guide, and that is a role no model ever can take from you.